Hi, I'm Dr. Andrew Samis. I'm one of the ICU doctors and general surgeons here at Quinte Healthcare. There are a lot of practical tips around how you can isolate at your house. And the most important thing to remember is that COVID is spread as an aerosol. And so the person with COVID needs to isolate from everyone else at home from the air that they breathe. If your house is such that they can isolate so that their room and the bathroom is in one part of the house that no one goes into, that is probably the best. But if not, the person should stay in their room with the window open a little bit and then put on a proper mask and move to a bathroom that's designated only for them to use and then back to the room. It's important that you don't share a bathroom so that other people in the house don't contract COVID. You shouldn't share eating utensils with someone who has COVID. For many people isolating at home, they'll use paper plates and disposable cutlery, which are then kept in a garbage can in the room so that when you're serving the person with COVID food, none of the dishes come back out. But if they are, they need to be separated from everyone else's dishes, but they can be just washed with regular soap and water. Ventilation is very important, and it is important for the person to keep the door closed in the room and perhaps open a window. I've even known people who will keep the door completely closed at all times and will take the food for the person with COVID to the window and wearing a mask and goggles pass the food to them through the window so that the door stays closed to the remainder of the house. Communication is really important when you're isolating from COVID, and some of the worst psychological symptoms can be that sense of isolation. It's really important to set up some form of dialogue, and that can be through an iPad and FaceTime. It can be through walkie-talkies. And one of the great innovations, if you have something like Alexa at home, is you can buy a remote component of Alexa which allows it to function as an intercom, and you can talk freely between people. But think ahead of time about how you're going to communicate, because leaving someone isolated in a room like that is very difficult for them. It's important to have something to occupy your time, such as an iPad, a computer, and your phone when you're isolating from COVID. Because you want the minimal interaction with someone with COVID, generally only bringing them meals, etc., it's worthwhile to pick up a bunch of snacks and have it for them in the room, so they're not continuously asking for food. And remember, with Omicron, with symptoms of sore throat and runny nose, hydration is important, so making sure they have something to drink in the room that they don't have to keep asking for a drink is important. So bottled water or other beverages are nice to have on hand. It's imperative that if someone's isolating in a room and they have to leave the room to use the bathroom, that they always wear a mask. And it's imperative that the remainder of the house wear mask and eye protection when dealing with that person. It's best always to keep distance from them, but you should always have a mask and goggles or a face shield. And gloves can be important when handling artifacts from that person. It's imperative that you stay at home if you have COVID. There may be important times that you do have to leave the house, such as if you're on your way to the hospital, and in that case it's best that the person with COVID take their own vehicle. But in general, you should stay at home and not go out to stores, etc., when you have COVID and isolating. However, if you do want to get some fresh air, it is okay to go outside by yourself. You can take a walk as long as you're not near people and it's not an urban environment, and it's important to wear a mask when you're out. Sometimes if it's a sunny day and you can get out into the fresh air far away from other people, it can be great for your mood. Another important thing is that if you have someone at home isolating with COVID, that you should keep all visitors away, especially those who are older, unvaccinated, and more vulnerable. Essentially, your house is out of bounds to visitors if you have someone home with COVID isolating. It's also a good habit for the remainder of the house to always keep surfaces clean and make an effort to wipe down surfaces while someone is isolating in the house. Additionally, for people who are lucky enough to have something like a cottage or a leisure property, it can be a great opportunity for people who are isolated from COVID to go to that location. But it is important that you don't have someone isolate alone and away from someone in case the COVID gets severe. When someone in your household has COVID, often you've been living with them when they discover that they have, and the remainder of the house has to isolate. Some advice around how to do that based on practical experience. The first thing is the person with COVID needs to be separate from everyone else in a room with the door closed that is kept closed. But for the remainder of those people, a number of them may come down with COVID in the days following. So for that group, it's important that they wear masks when interacting with each other. They try to stay apart as much as possible, and if possible, try to sleep apart. Some even going as far as sleeping with masks on. Because one of the challenges is that if only one of those members of the household end up coming down with COVID and the others don't, the others could get COVID from this additional person and not from the original person. So that keeping all of the remainder of the house separated as possible is really important, so you don't end up dragging COVID on and on and on in that house. So for the remainder of the people in the house, try to stay separated. Try and wear masks at all time. Try to sleep in different places, even if it means some people sleeping on couches. And try to take your meals at different places and different times. That way, you won't end up propagating COVID one person after another person after another person and stretching out the COVID exposure in that house for a long period of time.